for community resilience. It's about going global. How can we sustain the momentum that we have at community level and yet be able to reach scale, being able to reach more communities? We have several challenges. One is that our intervention model is costly and it really relies on project funding, meaning the National Society usually is not able to continue a community resilience project without our support. We have well-trained staff and highly specialized volunteers, but that also limits our ability to transfer our approach to other organizations or even to bring on a large number of volunteers. Red Cross, as in our methodologies, a lot were designed for rural communities, and yet at the same time, many of our urban communities are not based on a particular geographic focus. We have communities of taxi drivers, communities of people with the same religious or political affiliation. These are a lot of the communities that we find in our growing urban settings. Urban being a large part of where our communities will be in the future, this is a challenge for our work in building resilience. Now let's look at a specific example of what this could be in a given city and think through, have a little bit of a visioning exercise as to how we could take our RITA resilience approach to scale within the Americas where we're currently working. So let's look at one country, Colombia, one city, Riohacha, about 140,000 people, and look at the work that the Red Cross has done in its number of communities alongside the main runway in the city, a highly vulnerable area, and try to see some of the work that has been able to carry out. Highly specialized volunteers, a lot of work was done there. It was able to achieve a lot, but at the same time at a cost, which means the project is not replicable to other organizations. At the same time, we have methodologies that have been tried and tested and that we know are very effective. And the idea would then be to see if we can review our existing tools and see to what extent we could simplify them, break them into manageable pieces so we can bring on new volunteers and have these volunteers trained in specific components of our resilience work so that no one needs to be an expert in everything, yet is able to work at community level from day one through a simple induction into the community resilience work without being an expert in anything. So the model we're going to propose here is a model based on street level interventions where I may have, say, a couple of volunteers from, let's say, the Rotary Club. The Rotary Club may be partnering with the Red Cross in our resilience approach and has two people highly interested who live in the same block who want to apply some of our tools. Well, maybe they would be able to go and do a transect walk. Maybe they can go and walk through their neighborhood and start identifying some of the risks that are there. And then perhaps sit down and do a little drawing, identifying what they found, some of the things that came through this transect walk, and as they do this process, raise interest from their neighbors, some of whom they may know, some they may not know, and together work on an actual map of their community, something that we have been doing a lot in RITA, and as we've explained earlier, is very important, not as much for the component of collecting information as much as it is for people to work together, build that cohesion, and understand they have common challenges. So as we have this very localized intervention through volunteers who are trained only on a couple of tools, they would be able to really build that capacity in a given neighborhood. Here's another neighborhood, a neighboring one where we could have a similar approach. Why not do it again through the local football team a few blocks down and another block, and do it again with the local religious group who is also interested in taking on this mapping of the risks and carrying out transect walks. So the idea here is to break down our approach so we're able to work in urban settings where people may not have a large interest in attending a series of meetings. All we're asking them is to be available once over the course of the mapping exercise as they see people walking around, carrying out an analysis and share their thoughts without having that longer time commitments that is difficult to obtain in these urban settings. Each of these streets would then have a couple street representatives, could be these same volunteers, could be others, who are then responsible to take this information up to a higher level. Let's call this our neighborhood. And within our neighborhood, which would regroup maybe 5 or 10 of our blocks, but also obviously allowing us to go to a larger scale than our traditional 100 or so households that we look at in rural areas, and collect all that information and get these local street representatives to work together. They could work on, first of all, mapping what are all the organizations that exist within that specific neighborhood, to make sure that they've included a lot of these partners and that these partners then come to join these street representatives for these discussions. And together they could work on combining all of these street maps into a single more consolidated one that actually reflects the richness of the information provided and collected by these street representatives. We could then carry out a more detailed, say, historical profile of the neighborhood in a way that allows us to collect, again, gather on people who have more of an interest in these areas and these topics, and work with them. Yet the main component here is to say that we have the ability to share or transmit these methodologies and do not necessarily have to do it ourselves as Red Cross. The same thing can apply at city level. So now if we're looking at the whole city, there's a series of methodologies that will allow us as Red Cross to bring on a lot of partners on board. So this is an actual example, a real example from that same city, RITA, where the municipality got together with the Red Cross and a few other organizations, identified local interest in moving this process forward. They then had a planning meeting towards establishing a steering committee, and then they had a coalition inception meeting at the end of July to try to work towards the organization of a resilience component in the annual civil protection workshop. So it allows them to then focus as a collective at a municipal level on some of the activities that they think are of common interest based on some of the initial feedback from the community work. This has allowed them to then go into a little more analysis, this more structured discussion, looking at some of the challenges around the physical and ecosystems of their city, the legal and cultural norms, and the people and organizations. And from there, carry out a mapping in the same ways we do it at community level, a mapping of the partners at city level. So the same ways we have our street level coalition and our neighborhood level coalition, we have a municipal level coalition. And this allows us to have a detailed mapping, a risk map of the city, identifying where are some of the most vulnerable sectors within that city. This is where there's a linkage between the municipal level and the neighborhood level. We're missing that intermediary level in our current work in RITA, which would be that sector level. So again, thinking forward, why not include a sector level in which we're able to apply some of the elements from, for instance, the UNHCR's 10-point checklist, taking the municipal discussion down a notch to each of the different sectors within that city, and use that sector as a mechanism for bottom-up analysis of data that comes from these street level discussions. So if we look at our sector, if we have here our different streets that combined together provide us with a geographic community, these combined with other such geographic communities will give us our sector here represented on this map. Now our sector representatives will be representatives from each of our different groups from the neighborhood discussions, but not only. We'll also have a discussion then with other organizations. We'll look at how do each of our community action plan priorities compare across the different neighborhoods and come with a single list. So this is the example that was shown in an earlier video, would reach a single document that represents the sector's priorities and what the community has already been able to achieve, what some of the partners have been able to achieve, and where are the gaps and the pending issues that the sector would need to reach out to others. So to do so, it needs to do, again, a mapping of stakeholders, not only to ensure that all the partners within that sector are included, but also to ensure that we're including non-geographic groups of interest, non-geographic communities. So we may have, again, we mentioned taxi drivers earlier. Why not include those in that discussion? They can then go into a little more detail when they combine our different non-geographic communities along with different, could be governmental, non-governmental organizations to help, for example, mapping out flood-prone areas or do more detailed analysis on some of the studies that have appeared across the different neighborhoods as a priority, and start mapping out, according to one of our traditional Red Cross tools, a month-by-month prioritization to see what is the best time to engage with these different communities to carry out activities. Again, using our street level and neighborhood level representatives as relays to ensure we have this back and forth between the sector and each of the individual streets where there is representation. So all this brings us back to the city level, where the issues that cannot be addressed at local level, at neither the neighborhood level nor the sector level, will be then brought up. We've come across in RITA a lot of issues around land tenure, issues around flooding, flood-prone areas, and so forth that perhaps cannot be addressed locally because they involve heavy investments and cannot necessarily be addressed with our limited Red Cross or other local organizations resources. So there the idea is that the municipality itself will examine those and see which ones it can address through its municipal resources, reach out to governments, use that coalition at city level to bring in more partners, foundations, and so forth, as well as link that up to the city level. So if we're looking at this particular city in Colombia, maybe there is in Colombia a number of existing coalitions that could help us address some of the challenges. We could have a Colombia mechanism around global road safety. It's a global partnership. If Colombia is part of that, perhaps it can tap into some of those resources. Same thing about the Global Water Sanitation Initiative, which may be able to help cities in Colombia access better water and sanitation. So this is just an example of some of the existing initiatives that exist, that could exist in a given country, in this case Colombia, that would help us then to channel some of the existing initiatives to the city level and from there to the sector level. And of course, these global initiatives come from the global level, and that brings us back to this global discussion about how the 1 Billion Coalition can really tie into the most local level through a series of coalitions. So we're a coalition of coalitions to address our global vulnerabilities and global risks. Thanks a lot, and looking forward for more videos.